In the conversation about diet and health, one uncomfortable truth stands out. Not everyone has the same access to good nutrition. While obesity and diet-related diseases affect people across the socioeconomic spectrum, the burden falls heaviest on those with the fewest resources. In lower-income communities around the world, ultra-processed foods, UPFs, cheap, convenient, and aggressively marketed, have become dietary staples, not by choice, but by necessity. This is nutritional inequality in action, a system in which the quality of food people eat is determined less by knowledge or willpower and more by income, geography, and corporate influence. Ultra-processed foods are energy-dense, shelf-stable, and inexpensive to produce. From sugary cereals and packaged snacks to instant noodles and soft drinks, these products dominate the shelves of discount stores, corner shops, and supermarkets in low-income neighborhoods. They are often the most accessible source of calories for families trying to stretch tight budgets. And while they may offer short-term satiety and convenience, they provide minimal nutrition, contributing to long-term health problems such as obesity, type 2 diabetes, heart disease, and certain cancers. The affordability of UPFs is central to their appeal. Per calorie, ultra-processed foods are often far cheaper than fresh fruits, vegetables, lean meats, or whole grains. For someone living on a limited income, feeding a family with highly processed options is often the only viable choice, especially when healthy alternatives are priced out of reach. It's not that people in lower-income groups don't care about nutrition. It's that the economic system makes it easier and more sustainable to eat poorly than to eat well. Availability is another key driver of nutritional inequality. In many low-income areas, often referred to as food deserts, access to full-service grocery stores is limited or non-existent. What's available instead are small retail outlets, gas station convenience stores, or fast food chains, places where ultra-processed foods are the norm and fresh produce is scarce or overpriced. The result is a kind of forced consumption where the easiest foods to find are also the least beneficial. Aggressive marketing compounds the issue. Large food corporations invest heavily in targeting low-income consumers, particularly children and minority groups, with advertising for sugary cereals, snacks, and beverages. These ads are often placed in communities that already struggle with diet-related health issues, reinforcing unhealthy norms. Bright packaging, cartoon mascots, and value meal deals create the illusion of abundance and choice, when in reality the options are narrowly focused on low-cost, high-calorie, low-nutrient products. The consequences are visible in public health data. In many countries, rates of obesity, diabetes, and metabolic syndrome are rising fastest among the poorest populations. Children growing up in food-insecure households are more likely to develop poor eating habits, suffer from nutrient deficiencies, and experience early-onset chronic diseases. This is not the result of ignorance or indifference. It's the predictable outcome of a food environment that prioritizes profit over health and places systemic barriers between people and real nutrition. Yet this reality is often misunderstood. Narratives around obesity and unhealthy eating habits still tend to focus on individual responsibility, ignoring the structural forces at play. Telling people to eat better without addressing cost, access, and corporate influence is not just ineffective, it's unjust. Nutritional inequality is a form of economic inequality, and any serious effort to improve public health must confront it directly. There is, however, room for hope. Policymakers and communities are beginning to push back. Some cities have implemented taxes on sugary drinks and subsidies for fruits and vegetables. Others are investing in community gardens, mobile produce markets, nutrition education, and cooking classes targeted to low-income families. Schools and food banks are working to improve the nutritional quality of the meals they serve. These are important steps, but they must be scaled up and supported by broader reforms in food pricing, agricultural policy, and corporate regulation. Technology can also help close the gap. Smartphone apps can guide users toward healthier food choices on a budget. Online retailers can provide lower-cost access to non-perishable whole foods. And digital platforms can amplify community voices calling for change, especially in areas where the food system has failed them for generations. Ultimately, solving nutritional inequality means redefining what we consider a basic human right. Everyone, regardless of income, deserves access to food that supports health, not undermines it. That means affordable, nourishing options must be as easy to find and as heavily promoted as the products that currently dominate low-income food environments. Until that happens, the conversation about health, obesity, and diet will remain incomplete. Food should never be a source of suffering. But in a world where the poorest are fed the worst, that's exactly what it becomes. Changing this reality starts by recognizing that good nutrition is not a luxury, it's a foundation for dignity, equity, and long-term well-being. The solutions exist. What's needed now is the will to make them universal.